Hello and welcome to NCTV episode 75, which is all about managing fatigue, in particular the topical post-viral fatigue and chronic fatigue syndrome varieties. Firstly, I should say that there is no known cure for post-viral fatigue syndrome or chronic fatigue syndrome, although treatment may help to ease symptoms. Healthcare professionals can help to reduce some of the symptoms by having your GP prescribe medication and other therapies. However, some people face the challenge of living with these ongoing symptoms for some time. There is good news though, in that we know that these symptoms can generally improve in many people. We also know that learning ways to manage the condition can help people to make improvements. Ultimately, a team of professionals is needed for treatment, advice, support and counselling. That team, very importantly, should also include your family and close friends. In actually treating post-viral fatigue syndrome and chronic fatigue syndrome, there are a number of options that can be considered. Firstly, to manage your symptoms with medication, for example painkillers, anti-nausea medication and antidepressants. Secondly, manage your quality of life and general functioning. How can you do that? Well, here are 5 ways. Sleep is one way. Any changes to your sleep pattern, for example having too little or even too much sleep, may actually make your tiredness or fatigue worse. This includes sleeping in the daytime, which should ideally be avoided, and any changes to your sleep pattern should be done gradually. Rest is another way. Setting aside times to rest rather than actual sleep is very, very beneficial, so be sure to introduce rest periods into your daily routine. These should ideally be limited to 30 minutes at a time and be a period of relaxation. Speaking of relaxation, this can help to improve pain, sleep problems and any stress or anxiety that you may have. There are various relaxation techniques such as guided visualization or breathing techniques, which you may find useful when they are built into your rest periods. Another way is to manage your quality of life and general function is through pacing. This means balanced periods of activity and rest and becoming aware of which activities demand most from you. Ideally, you should aim to stop activities before you feel the impact so that you have enough energy in reserve. Doing too much on a good day may make you feel the impact later. It can take time to change your usual activities, but pacing is very important in managing your condition in the long term. And lastly, diet. It's very important that you have a well-balanced diet. Try to avoid any drinks and foods which you are sensitive to. Eating small regular meals that contain some starchy foods is often beneficial. Additionally, avoiding spikes and drops in blood sugar will help manage your energy levels and make you feel more settled. A third treatment for fatigue is graded exercise therapy. This is the use of regular physical exercise to aid recovery from these fatigue syndromes. With regular exposure to low-level activity, the body begins to adapt and gradually increase in an individual's tolerance to carrying out that activity. Another treatment is cognitive behavioural therapy, CBT, and that is talking therapy where this can help to manage your problems by changing the way you think and behave. It's most commonly used to treat anxiety and depression, but can be useful for other mental and physical health problems too. Fifth, manage your mental health. Counselling and support groups can be used to help with this. Sixth is general support. Depending on the severity of illness, other support may be needed, for example carers, nursing, support equipment and adaptations to the home to help you overcome disability. If you're employed, your doctor will be able to advise you about whether you should take time off work, and if you take time off work, when you may be ready to go back. It may be that you need to do work slightly differently, maybe change the hours or even have different duties. If you have an occupational health department at work, they are also likely to be involved with you regarding work and going back to it if you take time off. And lastly, to manage setbacks or relapses. It can be common to have a setback when symptoms become worse for a while. These can have various triggers, for example, poor sleep, infections, or stress. Some strategies which can help during a setback may include relaxation techniques, talking with your family, and finding the right balance between activity and rest, if possible. However, it may be necessary for you to reduce or even stop some of your activities and increase the amount of rest that you have during a setback. Following on from a setback, try not to despair, as you should gradually be able to return to your previous activity level. That's all for today, and I'll see you again next time for some more bite-sized bits to help your health flourish. Bye bye for now.